Hi, today I wanted to talk to you guys about doing pre-ops. So I have a packet of a made-up patient that I did. So the first thing you'll do is when you go through your schedule in the morning, if you see the word pre-op, you'll go into the patient's chart and you will print off the consent, the surgical consent packet that Ashley scanned in there for you. And in the packet, it's going to contain a list that looks like this. And when you print out your packet, put that little checkoff list right on top of your surgical packet and give it to your doctor. And he's going to review all the things that he will need for surgery. Some doctors will prescribe antibiotics before surgery. Some doctors will prescribe blood thinners. Most patients will get a cam walker or a surgical shoe. Some will do prescriptions for knee scooters and crutches and things like that. So they'll let you know on this form what they need for the antibiotic. They'll let you know how many days they want the patient on. So very important to keep the patient's preferences updated in their chart. So make sure we have the right pharmacy. So when you bring the patient back, you're going to go over the paperwork with the patient. The patient's going to sign every form. You will witness every form, and then we give a copy of the forms to the patient before they leave. The first page this is the patient information, the surgery information. This page tells the patient where they're having the surgery done, the date, their time of surgery, and then their estimated arrival time. Let the patient know that the estimated arrival time and the estimated time for surgery can change, but this is it. The surgery centers call the patient the day before, and they review their the surgical fees and the time of surgery and what they need to bring. So let the patient know the surgery center will call the day before surgery and give them all the final information that they need. So first thing, no food. They need to be fasting after midnight. If their surgery's in the afternoon, make sure that they are fasting 8 hours prior to their surgery. The next item is wash the night before, remove nail polish. It's mostly for the fingers so they can do the O2 sensor. Make sure that their feet are clean. Important. Blood thinners. Stop taking blood thinners. That includes NSAIDs. So you want to ask your patient, do you take aspirin on a daily basis? Do they take Coumadin or warfarin? If so, they will need to stop them a week before surgery. NSAIDs includes aspirin, Aleve, Mobic, those type of medications. They need to stop those a week before. And they can also discuss that with the physician. If they're on a blood thinner like Coumadin, usually that gets referred to their cardiologist. The next thing is only take blood pressure medication with a sip of water or half a dose of insulin. I let the patient know. Just double check with your provider that you're seeing today, and just double check with them if that's okay for you to do beforehand. Most of the time that's fine, especially if it's in the afternoon, if their surgery's in the afternoon. No driving. They'll need someone to take them to surgery and take them home. On here it says to bring their cam boot or a surgical shoe. Sometimes the patients will get a posterior splint. In that case, they don't need to bring the cam boot, but they might want to bring their knee scooter or crutches, anything that's going to help them get into the car and back into their house. Pain medication is given at the time of surgery, and we do antibiotics in the blood thinner at the pre-op. It's just easier. That way they have it on hand. The blood thinners, they start the next day, the day after surgery. The antibiotics, they can start that day. And then the last thing on this page is history and physical and blood work. Ashley is very good about, she will fax over the history and physical form if they need one to their primary care, and the patient usually gets their blood work done or gets the order sent to their lab. If the patient does not have an order for lab and they do need it, you're going to order a CBC, a BMP, a PT, and a PTT. A BMP stands for a basic metabolic panel, and a CBC stands for a complete blood count. Okay, so then you'll have the patient sign this form, and then you will sign and date. Okay, the next form here is what to expect on your post-op care. On this page, it looks like this. I highlight this and where they need to sign. You're just going to review with them pain. Take your pain medication when you get home. Swelling. Swelling that comes hand in hand with surgery. Make sure you tell the patient to elevate and ice. I usually tell the patient to ice behind their knee or on top of their ankle. Behind the knee, there's a main artery back there, and it really helps with swelling. Their dressing, they will not touch their dressing. The patient will come in a week after their surgery, and we will do a dressing change their first week, and the following week they'll come in and we will we'll change their dressing, take their sutures out, and sometimes get x-rays. Sometimes the doctor wants x-rays on their first visit. So you just need to clarify that with the physician when you're doing your morning huddles with them. Bleeding. Bleeding is common after surgery. If a patient is bleeding through their bandage, usually just have the patient, hey, if you notice this, just give us a call. If it's not stopping, definitely give us a call. We can have them come in and change their bandage. Weight bearing, that is up to the physician whether or not they weight bear. If they're full weight bear, non-weight bearing, the doctor can discuss that with them during the pre-op as well. And observation, if they notice their redness, or they're having more pain, or a fever over 101, they're to call us. They're to call the office. Now, our phone number is on this form. I tell patients that if they have any questions at all, to call the office. Don't hesitate. Even on the weekends, someone is on call for them. The next form is our surgical consent. I'm sure most of you have seen these in the office. Patient's date of birth, what they're having done. The doctor will fill this part out, okay? What we need to fill out on this one is allergies. Super important that we review their allergies with them, okay? The patient signs here, and then we sign down here, and the doctor signs here. Very important for the patients to sign this form before they leave the office. Any form that you sign, that the patient signs, please make sure that you witness. The next page, it talks about DVTs. DVTs, they happen in the legs and in the lungs, which is a pulmonary embolism. So these are the things that I review with the patients. If they're having any pain in the calf, if they're having more swelling or redness, fever over 100, 101, they are to call our office, and usually they'll come in, or we'll send a referral to have a venous ultrasound done to rule out a DVT. And then the other thing is that we go over is a pulmonary embolism. If they're not moving around a lot, if they had a big surgery, they are at a higher risk, especially if they're on hormone therapy. So this is a clot in the lungs, and signs of that is shortness of breath, fever, rapid breathing, bloody cough, and chest pain. The doctor will let you know on this page what they want the patient to be on, whether it's just physical examination, if it's Xarelto, Lovanex, aspirin. They'll put that on that first form that I showed you. So you can just verify with the doctor on these medications how many days they want them on this medication. And these medications are already like pre-built in the system. And then again, verify their pharmacy. So we'll do that at the time of pre-op as well as send in that prescription. And then again, sign and date. And the next form is the impact of smoking. This is kind of like a contract that we have our patients sign. If they are smokers, they need to be aware that it can prevent healing. They do need to read this page. and let them know that that can happen, that it can have a big impact on their surgical outcome. They won't heal correctly. It causes more blood flow during surgery, and it reduces blood flow as well. So just make sure that we have this checked off if the patient is a non-smoker, or if they do smoke, just that they need to understand that they are at a higher risk. You print their name, have them sign it, and then you sign at the bottom. Dr. Milliron, not all the doctors use these forms, but Dr. Milliron does like to use these forms. She'll fill in on this form what the patient's having. If they're going to have implants, she'll put the little implant on here, and she reviews this with the patient. I do have, sometimes she'll do it before she goes in, or sometimes she'll do it when she's talking to the patient. Just make sure you have the patient sign that. And this next one is also where their sutures are going to be. So again, they'll draw on this form where their suture lines will be, and just have them sign that. Once everything is signed, you'll make a copy of it, and you'll give it to the patient. If there's DME equipment, if we're giving a cam boot, you need to make sure that we have them sign the DME form. If we're doing a knee scooter or crutches, we need to make sure we do a prescription for that. I always like to, depending on their insurance, I like to give them a copy of the prescription. If it's a Florida Healthcare patient, I send it right over to Apria. And I do also give them a prescription just in case. We do sell cast bags in the office, so because the patient cannot get their dressings wet. So also offer that to the patient, that we do have them in the office if they'd like to purchase them. Let me know if you guys have any questions. Hopefully this will be helpful for you. To when you do these, if the patient asks you, hey, if they ask you a question you're unsure of, just say, well, let's ask the doctor, and make sure that question is answered before you guys leave. So let me know if this is helpful for you guys. Have a good day.